Hello everybody and welcome to the Thursday edition of Video Clips. And just a couple things to remind you of. First of all, if you're interested in careers with Wellness Farm Health or training for a career in healthcare, Pam Popper at MSN.com. The Food Over Medicine coaching program, which allows you to open a chapter, Food Over Medicine chapter in your area if you choose to, starts soon. So if you want to talk about that, send me an email. And Research and Writing starts soon. At the end of this month will be the first class. It's a 10-class series. Essentially, we start by learning some research basics, and then every class we research together. So you're on the teleconference call, and we're all together, open up our browsers, we choose a topic, and actually I choose a topic, and then we do research, and between classes you write papers which I critique. So if you're one of those people that says, I'm so confused and I don't know who to believe, and I watch your channel and it seems like you make sense, but then somebody else tells me something else and I'm confused, you can stop being confused. Let me teach you how to not be confused. It's a fun class. I taught it last year. I had 58 people in my class last year, which was great. A lot of paper grading for me to do, but everybody really enjoyed it, and they learned how to distinguish good from bad research, good information from bad information, and how to look up things they want to know about. So you guys often write to me and say, what do you think about this and what do you think about that? Well, my gosh, I can't research everything. I don't have an unlimited amount of time, so wouldn't it be great if you could figure some of that stuff out on your own? So if you want to talk about any of that stuff, send me an email at pampopper@msn.com. All right, so I don't know how many times you've heard this. If you're a regular listener and watcher, I have said I'm not going to write any more articles about vitamin D because I've covered it and we don't need any more information. It's a ridiculous situation. It's a myth. It was invented by a doctor, etc. Well, there's always something new to write about, and I can't resist it. So here goes. The Endocrine Society recommends that adults take 10,000 international units of vitamin D in supplement form daily. And they do it for two reasons. The first one is to increase intestinal absorption of calcium supplements and to decrease the risks associated with taking calcium supplements. The advice to supplement with both vitamin D and calcium is based on faulty research, I have to say this, and also a fundamental misunderstanding as it pertains to vitamin D because it is a hormone, not a vitamin. Vitamins, by definition, are substances that the body cannot produce and therefore must be consumed in food. Vitamin D is a hormone that is produced in response to sunlight and is not a nutrient found in food. Nonetheless, operating under the incorrect assumption that vitamin D is a vitamin and more is always better and that something natural cannot possibly be harmful, and many other misunderstandings, doctors and health professionals routinely recommend that people take both vitamin D and calcium supplements. Research on the supplements is mostly focused on benefits, which have proven to be very few, and ignored the fact that there could be side effects. And as a result, the clinical trials really aren't structured to collect adverse events, and only acute toxicity has been reported in the case of vitamin D, extreme cases. But due to the widespread use of these supplements, there is an increasing interest in taking a look at harmful side effects. And you might remember, there are several articles in the Health Base Library about this, and you might remember a few months ago I covered a study showing that taking vitamin D and calcium led to a significantly higher risk of developing some of the most aggressive forms of polyps that are more likely to turn into colon cancer, for example. Well, a new study sought to look at the risk of both hypercalcemia and hypercalciuria for people who take the amount of calcium recommended by the Institute of Medicine for adults 51 years of age and older. And by the way, it's 2,000 milligrams a day, which is a ridiculously high amount. And the amount of vitamin D recommended by the Endocrine Society, 10,000 international units a day, crazy amount. Or the federal RDA, which is 600 to 800 international units a day. The study was a randomized double-blind placebo-controlled trial that included 132 subjects and lasted for a year. Now, subjects were randomized to one of two groups. One group took 10,000 international units of vitamin D and 1,200 milligrams of calcium. So the assumption was that people would take in 800 milligrams of calcium from food. The other group took in 600 international units of vitamin D with the same amount of calcium based on the same assumption, which is that there would be 800 milligrams from food. The study showed that taking vitamin D with calcium supplements was associated with frequent episodes of hypercalciuria, even at a lower dose. While this study was too short to evaluate the risk of kidney stones, the authors noted that the Women's Health Initiative showed a 17% increase in kidney stones for participants taking only 1,000 milligrams of calcium and 765 international units of vitamin D. They stated that it is likely that higher doses of calcium would result in an even higher incidence of kidney stones. In addition to all that, parathyroid hormone levels were lower in both groups, which was expected since calcium and vitamin D supplements are known to lower parathyroid hormone production. Lower parathyroid hormone production has the potential to cause a whole host of additional side effects, which I won't get into here because I don't want to get too far away from the point, which is that this may not be good for you. 37 patients had 64 adverse events in the high vitamin D group, while 38 patients had 67 adverse events in the low vitamin D group. So high incidence of adverse events. The researchers stated and concluded that 10,000 international units of vitamin D per day with 2,000 milligrams of calcium should be considered a pharmacological dosage of these nutrients. And note the incorrect reference to vitamin D as a nutrient, which makes me crazy, which is why I keep putting out this information and talking about it, because the misunderstanding is just, it boggles the mind. There are very few benefits associated with vitamin D and calcium supplements and considerable risks, and patients who are taking these supplements should really consider carefully whether or not they're going to continue. All right, next topic. According to the president of the Society for Patient-Centered Orthopedics, quote, "We do too many knee replacements," end of quote. This is most likely true. Data show that between 1999 and 2008, the rate of knee replacement surgery doubled. And some of the increase, of course, there's some of it that's due to people being more overweight, but a lot of it is direct-to-consumer advertising. And this happens in all branches of medicine. The expansion of the types of conditions for which knee replacement is recommended. So the way you really make money in medicine is you take something that helps a small group of people and you convince a whole lot of other people that they need it too. Well, the result of performing too many procedures is that as many as 1/3 of patients continue to experience pain after the joint is replaced. This same study, by the way, showed that pain persists in between 7% and 23% of people who have hip replacements too. Another study showed that having a knee replacement resulted in, quote, "minimal effects on quality of life, particularly when patients had a much less severe form of arthritis." The researchers noted that restricting the procedure to only those who qualify would not only lead to better outcomes, but would have a significant positive effect on the economic benefits of knee replacement surgery too. In fact, limiting treatments to people who qualify would reduce our health care bill by about 2/3. We have enough money to take care of everything in this country. We're just squandering it on ridiculousness. Well, a growing market for knee replacement is younger people in their 50s and 60s, but a major problem with performing surgery on these people is that the joints are designed to last for about 20 years before they wear out. So if you have joint replacement when you're 83, you're likely to die before the joint wears out. But over time in younger people, the implants loosen and detach from the bone. Debris detaches from the joint, causing inflammation and pain, and the knee can actually break due to wear and tear, and it's much more likely for this type of thing to happen in obese patients because the extra weight that they carry places extra pressure on the knee. Research shows that in patients younger than 60 who have a knee replacement, 35% of men will need to have the artificial joint replaced and 20% of women will have to have another surgery. Surgeries to replace artificial joints are fraught with complications, which include scar tissue, difficulty in extracting the bone cement used in the original procedure, and the risk of fractured bones when the artificial knee is removed. One of the reasons why so many people opt for joint replacement surgery, I am convinced that this is true, is that when patients visit orthopedic surgeons who perform these procedures, they're not likely to be told that there are risks associated with the operations or that there are other options. Orthopedic surgeons are trained to do surgery, and most of them are not referring people to diet and lifestyle classes and weight loss programs or yoga. But research clearly shows that other options are just as or more effective. For example, a study including 100 older patients who were eligible for knee replacement surgery showed that over a 2-year period, all of them improved, including those who were only given non-surgical treatments like exercise, dietary advice, and pain medication. While the patients who had the surgery did better initially, they had 4 times as many complications such as infections, blood clots, or knee stiffness that was severe enough that another surgery had to be performed that required anesthesia. Complications are more serious with knee replacement surgery than many people realize. 1 in every 1 to 200 patients that has a knee replacement dies within 90 days of the procedure. There are situations, undoubtedly, in which knee replacement is the right thing to do and the only viable option. My dad had a knee replaced, and it really did change his life, but he was like 83. Back to when you do it when you're older. I hope my dad lives to be 120, but he probably will not live long enough, unfortunately, to need to have that knee replaced. In many cases, other options are safer and better, however. There are many cases, or many causes, I should say, of knee pain. Being overweight or obese is a major one, and weight loss not only will relieve the knee pain in many cases, but it takes care of a whole host of other problems as well. In some cases, the knee's not tracking properly due to muscle imbalances or injuries. When this is the case, a replacement knee doesn't function much better because that won't track right either. So you're much better off with physical therapy, with an expert who knows how to restore body symmetry. Some of you have heard me talk about or even seen this woman interviewed on my channel here. Eileen Kopsaftis is a physical therapist in New York and one of our business partners, and she's developed methods for restoring function permanently in people who suffer from all kinds of musculoskeletal disorders. And one of the problems we have is Eileen is amazing, but she's one human, and one human can only help so many people at a time. So in partnership with her, we've created this great video platform, and it allows people to resolve their pain issues, knees, shoulders, whatever's bothering you, inexpensively on your own at home. This program is offered in partnership with our company, and if you want information about it, you can either send me an email at pampopper@msn.com or call us at 614-841-7700. So bottom line is that, you guys hear me talk about this a lot, so much of what we do in medicine is phenomenal. And it's phenomenal, however, only if it's used for exactly the right population of people. So the first thing to determine is, if you're thinking about knee replacement, is this the best option for me and my state of health to resolve the actual cause of my knee pain? And in many instances, you'll find out that it is not the case. So other options are available that would be much better. Okay, well, hit the subscribe button. As usual, pass this on to anybody who you think might enjoy watching it. And I will be back to you next week with more news.